The western diamondback rattlesnake is a species of pit vipers found in the United States and Mexico. In the United States, it accounts for the second greatest number of fatalities after their cousin, the eastern diamondback. The western diamondback commonly grow to about 4 feet or 125 centimeters in length. While rare, they can grow to over 6 feet with males larger than females. Weight is generally between 4 and 6 pounds, with large specimens weighing up to 15 pounds. While the color pattern is mostly brown and gray, other colors that may be present include chalky white and hues of pink, yellow, red, and green. This ground color is overlaid with a series of 25 dorsal body blotches that are dark gray-brown. From the head, the blotches may vary in shape, but become more distinct further along the body until they take on their characteristic diamond shape. The tail has several bands that vary between ash white and pale gray. The western diamondback has a dark post-ocular stripe extending diagonally from the lower edge of the eye to the side of the head. The belly is off-white and unmarked. The range of the western diamondback is vast. They can be found as far east as Arkansas and extend to southeastern California, continuing south into Mexico close to its southern border. The preferred habitat of the western diamondback varies considerably, from flat coastal plains to steep rocky canyons, including deserts, scrubland, grasslands, and pine forests. Life expectancy can exceed 20 years, but is typically shorter as a result of predation as juveniles and human expansion into their territory. Outside of mating season, they are solitary. The western diamondback is considered one of the more aggressive rattlesnake species because they rarely back down from a confrontation. When threatened, they usually coil and rattle to warn aggressors. In winter, they hibernate, sometimes with other snake species. As the warmth of spring arrives, the snakes emerge, usually in early April, and remain active until late October. A detailed and comprehensive study in 1976 on the prey of the western diamondback in Texas showed that about 95% of their diet consisted of small mammals. Prey included many species of rats and mice, squirrels, rabbits, voles, prairie dogs, and pocket gophers. Some species of birds and lizards are also eaten. They hunt by either following commonly used paths in the underbrush by rodents or coiling up near a burrow entrance and ambush approaching prey. Their predatory behavior is important in keeping small rodent populations in control. In turn, they are preyed upon by large mammals such as coyotes and foxes, select species of birds of prey, and the common king snake, which is immune to the venom of rattlesnakes in their ecosystem. As with all other snakes and reptiles, the western diamondback do not produce body heat. Rather, they rely on their environment for warmth. As a result, they do not require as much energy to survive as warm-blooded mammals. This means that they can go for long periods without eating, up to 2 years in the wild. Unlike most reptiles, but as with other rattlesnakes, the western diamondback does not lay eggs. Rather, the young develop within the female and are born live. Gestation lasts about 6 months, and broods average a dozen young. The offspring stay with the mother for only a few hours before setting out to hunt and find cover on their own. Breeding occurs in spring. As with most other pit vipers, the venom of the western diamondback rattlesnake is primarily hemotoxic. That is, the venom affects mainly the circulatory system, blood vessels, and heart. Effects of the venom at the site of injection include severe pain and swelling, bleeding and bruising, as well as necrosis. Body system effects are variable based upon bite location and the health of the victim, but include headache, nausea, vomiting, abdominal pain, and diarrhea. Convulsions occur less often. The toxicity of the western diamondback's venom is far less toxic than many other rattlesnakes, and severe envenomation is rare but possible. Regardless, emergency treatment should be sought if bitten. The mortality rate of untreated bites is between 10 and 20%. The western diamondback, along with all other rattlesnakes, gets their name from their renowned rattles at the end of their bodies. The rattle is composed of a series of hollow, interlocked segments made of keratin, the same protein that makes up human hair, skin, and nails. They are created by modifying the scales that cover the tip of the tail. At birth, a pre-button is present at the tip of the tail. Several days later, the first skin is shed, and the result is the first rattle. However, no sound can be made until the second rattle emerges. A new rattle segment is added each time the skin is shed, and this may occur several times per year depending on food supply and growth rate. As the rattle is prone to damage, the western diamondbacks move with their tail held off the ground. Despite this, end segments of the rattle regularly break off. As a result, it is a myth that a snake's age can be determined by the number of rattle segments. An assessment of the western diamondback rattlesnake in 2007 by the IUCN Red List showed that their conservation status should be that of least concern. This is due in large part to their vast distribution and presumed large population.